Hello, welcome to ANA community. In this particular video, we are going to discuss about the learners' various levels of learning as far as the subject of Roga Nidana is concerned or Ayurveda diagnostic is concerned. So there are the students or the learners who are having the very much difficulty in learning a particular subject. Some students or some learners, they will be having the learning in a smooth way with a little amount of time, and some learners, they are having the very easy learning as far as the subject of any subject is concerned. Here we are going to discuss the what do you mean by these different levels of learning by the learners, so that we can able to categorize the learners into different categories, so that we can able to come to know what their level of understanding is. When you think about the learners of Roga Nidana, so we are dealing with the subject of Roga Nidana or Ayurveda diagnostics. So we are going to know about the different difficulty levels of the learners as such. When you think about the learners, so degree of learning may be of three categories: novice, pro, and star. So when you think about the novice, in the sense the students are not knowing about the particular subject well. That is what we can say novice. So based on this, novice and learners can be categorized under what do you say that the novice category. The next comes the pro. Pro in the sense they are knowing what are the different terminology, how this particular terminologies are being used in learning the subject well. So that is the pro as such. So we can observe the skilled persons, they can be categorized under pro as such. And when you think about the star learners, in the sense they are knowing the subject well with deep understanding, they can able to connect or create their own new concepts or hypothesize or make the hypothesis, their own hypothesis can be made in the subject. That is what we say that the star learners of the Roga Nidana as such. Now, how we can able to identify these novice, pro and star learners of Roga Nidana we are going to discuss today. When you think about the novice learners of Roga Nidana, so they are actually having the difficulty in learning the new terms. For example, what is the word meaning of Roga Marga? How Roga Marga can be understood, and how what is the extent of Abhyantar Roga Marga or Bhashya Roga Marga or Madhyama Roga Marga, etc. They can able to, they are not knowing the those different terms, they will be having the learning in difficulty there. So they are not knowing what actually Nidana is. So what kind of the that is, they may say it is etiological factor. How to identify the Nidana, they may finding the difficulty. How we are going to say Adhyashana may be the cause of the disease manifestation. How we can able to say Vyayama it may be the cause for the disease manifestation, etc. Because when you think about the Ayurveda textbooks, more than 3000 plus Nidana are observed in the Sushruta Samhita itself. So when you think about the others, what is it that the textbooks, we may get even more than that. So that is identifying Nidana may be a difficulty in the novice learners as such. Purahassara. The term Purahassara, it is the synonym of Purvarupa. So that is the people, novice learners, they may be having the difficulty in identifying that. How we are going to say the person is having the Purva Rupa? What is the criteria to say he is having the Rupa? How to identify the person is having the Upadrava or complication, etc. So they are a little bit difficult. They may be having the difficulty in learning the term Nishpatti. The term Nishpatti is the synonym of Samprapti. So the students, they or the learners, they may be having the difficulty in knowing that particular part. Amaya. What actually Amaya means? The disease. Why Amaya is being named? Because of the presence of Ama in the body, which is responsible for the disease manifestation. So that's why the diseases are named as Amaya. Specifically, the diseases which are considered to be Nija Vikara, they can be categorized under Amaya. Chinha. So that is considered to be Rupa. How we are going to say the person is having the Rupa as such? That is the difficulty there. Nadi. So that is the Ayurveda pulse examination. They may be having the difficulty in doing that. What is the meaning of Adhyatmika Vikara? So that is the Adibala, Janmabala or Doshabala, etc. They may be in a bit difficult area there. Kriyakala. What actually Kriyakala refers to? They may be knowing 6 stages of Kriyakala, but they cannot able to apply the Kriyakala in terms of Vyadhi. They are not in a position to understand Kriyakala in terms of the Chikitsa. They are not in a position to understand Kriyakala in terms of Sharira Kriya, etc. Then this difficulty may be observed. Srotas, in the sense, the whole body is composed of multiple srotas itself. Sometimes even individual cell is considered to be a srotas. So the understanding of srotas may be difficult. Sroto dushti. What actually sroto dushti refers to? When do you say the person is having ati pravritti? When do you say the person is having the vimarga gamana or siragranthi, etc.? The students are not in a position to understand it. And dosha vaishamya. How we are going to categorize the person is having the dosha vaishamya? They may be in a bit difficulty in understanding that particular part. And the students or learners, they may be having the difficulty in applying these terminologies in terms of real life case scenarios. So that means when the person is having the joint pain, they are not in a position to understand which particular Roga Marga is affected, which particular Nidana may be responsible for this particular disease manifestation, what are the Pura Rupa they are responsible for this particular joint pain, how we are going to frame out the Samprapti of the joint pain, whether what kind of the disease it is, whether is it the Nijavikara or Agantujavikara, and what are the Lakshana they are going to get observed, what kind of the Kriya Kala we are going to note about in case of the person who is suffering from joint pain, which particular srotas is being afflicted in case of the joint pain, and what kind of the srotodushti we may observe in that particular person, and dosha vaishamya, what kind of the abnormality of dosha is being observed, whether is it sharirika dosha or manasika dosha affliction, we can able to the novice learners are not in a position to apply these terminologies. They may be having limited background knowledge in terms of physics, in terms of chemistry, in terms of biology, in terms of basic science, in terms of Padartha Vijnana, in terms of Samhita textbooks, in terms of Sharira Kriya, in terms of Sharira Rachana, etc. They may be having limited background knowledge, which are considered to be very, very essential to upgrade yourself in the learning of the subject as such. Whereas the learners, they may be having applying these concepts also. They may be having the difficulty there. For example, how to apply the principles of physics, chemistry, and biology in terms of Roga Marga. They may be having the difficulty. How to learn the Roga Marga and human body as the side by side. They may not be in a position to apply that particular uh, comparison. The students are not in a position to apply the or analyze the concept of Roga Marga and Srotas as such. So that is these two learners, they may be having the struggling with the critical thinking skills. For example, the person is suffering from Amavata. So that is where the person will be having the multiple joint pain. The person may be having the loss of appetite, etc. Or the person may be having the uh, body ache, etc. How we are going to say the relation with the Roga Marga and Amavata, that the learners, they may be having the difficulty. They may be having the difficulty in categorizing or in differentiating Nija Karana and Agantuja Karana in terms of a Roga Marga application as such. So they may be having the difficulty. So they are having the lack of knowing about the concrete examples. So that means the person may be suffering from cough. They may not be in a better position to say what is the possible cause of the cough, whether the any kind of the source of the entry is possible through the oral cavity, through the nose, or through the paranasal sinuses, or through the esophagus, etc. They may not be in a position to understand it, or otherwise the what might be the cause of diarrhea, whether the lesions are present in the stomach, or whether the lesions are present in the small intestine, or whether the lesions are present in the large intestine, etc. The learners may not be in a position to understand it. And difficulty in abstract thinking. Abstract thinking in the sense the concised thinking, or otherwise the what we can say the term is elevator pitch. So if you are not having the time to have the discussion of 1 hour or so, you have to describe in such a way that that can be described in a matter of 1 minute or so. So that is what we can say the summarizing that may be difficult for the novice learners. And because why so this is happening is means because they are having the inexperience with the study strategies. They may not be in a position to do the notes properly. So there are what are the different types of the notes making, linear notes or non-linear notes, etc. Or they may not be in a better position to apply active recall and what actually spaced repetition refers to. So that is the novice learners, they may not be understanding that particular part. So this may be the scenario, the small image where the novice learner may be having. Sometimes they may be looking here and there, or sometimes they may be yawning, etc. etc. These are the characters of novice learners. Now, when you think about the pro learners, what may be the characters of pro learners as such? When you think about that, the pro learners, they are little bit having the easiness in learning the terms such as Roga Marga. So they may be in a better position to say three types of Roga Marga, Bahya, Madhyama and Abhyantara. Whereas they may be in a better position to say the Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra, wherein the Rasa is being analyzed with terms of the Twak itself. So they are considered to be Bahya Roga Marga. And they may be in a better position to understand Kushta may be a Bahya Roga Marga Javikara. So in that way, they can able to apply these Roga Marga term itself. They are in a better position to understand the Nidana, whether it is the Sannikrishta Hetu or Viprakrishta Hetu or Pradhanika Hetu, or whether is it Asatmyendirartha Sanyoga or Pradnyaparadha or Parinama, or whether it is Dosha Hetu, Vyati Hetu or Ubhaya Hetu, or whether it is Utpadaka Hetu or Vyanjaka Hetu, or whether it is Bhashya Hetu or Abhyantara Hetu. In terms of the Abhyantara Hetu, whether the Hetu is considered to be Vriddha Kshina or Samyavastha, or whether the Hetu is being present in the Shaka, Varmasthasandhi or Koshtha, or whether the Hetu is in the state of Chaya, Prakopa, etc. etc. or whether the person is having the Sama or Nirama stage, etc. So that is the Nidana aspect, the learners, they may be in a better position to say in case of pro learners as such. Purahassara, in a sense, they may be in a better position to understand whether the person is having the Pururupa or Rupa or Upadrava, etc. They may be in a better position to understand it. And they may be in a better position to understand the Samprapti properly. Whether the person is having the presence of pathogens only in the alimentary canal, etc., they may be in a better position to understand it. Or whether the person is having the Vriddha dosha itself, or whether the person is having the Kshina dosha, or whether the dosha is being observed, which particular guna is being increased in the body, whether is it Ruksha guna or Shita guna, etc., or which particular dosha is being dominantly affected, whether is it Vata dosha or Pitta dosha or Kapha dosha, or Rajo dosha or Tamo dosha being affected, or which particular ashaya is being affected, whether is it Amashaya or Pakvashaya, or which particular dhatu is being afflicted, whether is it Rakta dhatu or Mamsa dhatu or Medo dhatu, etc., the learners may be in a better position to understand this particular point. And Amaya, in the sense, they are in a better position to identify actually the cause of the disease itself, whether is it Adhyashana or Vishamashana or Samashana, etc. Chinna, what are the Lakshana that are being observed in an individual? They can be in a better position to understand that. Nadi, they are in a better position to perform the Nadi assessment. By that, they can able to say that which particular dosha is being increased at that particular time period. They may be in a better position to understand the Adhyatmika Vikara. They may be in a position to say that the person is having the which stage of Kriya Kala that is being affected. Whether is it Sanchaya or Prakopa or Prasara or Sthana Samshaya, etc. Which particular Srotas is being affected. Whether is it one Srotas affected or two Srotas affected or three Srotas affected or four Srotas affected or all the Srotas are being affected, that they are in a better position to understand. And whether the person is having the dosha vaishamya, whether is it in the vriddhavastha or kshinavastha, they may be in a better position to understand it. And when you think about the application of these, they can be in a better position to understand, apply these terminologies in case of the real case scenarios. So that means, for example, the person is having the knee joint pain. They are in a better position to understand it is the Madhyama Roga Marga means affected. As the person is having the pain, it is the Vata dosha is being affected. If the person is having the pain along with the joint swelling, they may be in a position to say whether it is Vata and Kapha dosha is being affected. In that way, they can able to apply these different terms in case of the real life case scenarios. And they will be having sufficient background knowledge in terms of the physics, chemistry and biology and basic sciences, Padartha Vijnana, Samhita textbooks, Kriya, etc. They may be having the better understanding. For example, in a vessel, the macromolecules, they are usually moving towards the vessel wall, whereas the lighter molecules, they are moving in the center. That is application of physics. Whenever if you think about the chemistry level, due to the presence of the enzymes in the alimentary canal, they are responsible for the conversion of macromolecules into micromolecules. This is the application of a chemistry. When you think about the biology, so that is heart as such, so that is pumping the blood nearly around the 70 to 80 beats per minute. Let us say this is the example of biology. So like that, the pro learners, they are having the background knowledge which are necessary for the learning of the subject as such. And of course, the difficulty in terms of the applying these particular concepts, that is PCB, that is physics, chemistry and biology and Roga Marga and human body, Roga Marga and Srotas, etc. They may be having a little bit difficulty, but the complete difficulty or absolute difficulty in terms of the novice learners, this may be absent in case of pro learners. And they are having a little bit struggle in terms of critical thinking skills. Of course, they will be less, but the thinking skills, critical thinking, they may be present in pro learners also. That is Roga Marga and Amavata understanding, or the differentiation Nija and Agantuja Karana, its relation with Roga Marga, etc. They may be struggling in that particular part. And they are in a the concrete examples they can be able to draw. that is cough and diarrhea. What might be the possible cause of cough? They may be in a better position to understand. Whereas the concise description, they can be done by the pro learners, and they may be knowing the different study techniques such as spaced repetition, or they can be in a better position to do proper notes making or mind mapping, etc. They can be in a better position to do that. Whereas the star learners, they are considered to be the topmost learners, what we can say the top 1% learners of the subject of Roga Nidana, wherein they can be in very easy for them to learn the new concepts such as Roga Marga, Nidana, Purvarupa, that is Purahasara, Nishpatti, etc. They can be in a better position to understand that with deepest level of understanding. How we are going to apply the concept of the dosha and pathogen, how to know about the source of the pathogen entry into the human body, how that is entering into the lymphatic system, how that is entering into the musculoskeletal system, etc., how that is entering into the asti vahasrotas or majja vahasrotas, etc. They can be in a better position to understand that, and they can be in a better position to describe to other people so that their knowledge is going to get even much more concretized. So that is the that kind of the easy learning is present in case of the star learners. They can be in a better position to apply these different terminologies in terms of the real life case scenarios. It's not only in case of the one diseases itself, multiple diseases, they can be in a better position to apply these. For example, the term atipravritti can be observed in case of the atisara, that can be observed in case of the prameha, that can be observed in cases of the raktapradara, etc. So that is the application of this particular term, srotodushti, they can be in a predisposition to do that. Whereas the sufficient background knowledge they are having, such as sufficient amount of the physics or chemistry or biology, basic sciences, padartha vijnana, samhita textbooks, kriya and rachana sharira, etc. They can be having sufficient background knowledge. For example, the principles of motion, that is the Newton's law of motion, they can be in a better position to apply in terms of the alimentary canal. They can be in a better position to apply in terms of intravascular compartment, etc., etc. So that is the application of these particular knowledge can be possible by them. Whereas they can be having the easiness, it's very easy for them to apply these concepts such as physics, chemistry, and biology in terms of the Roga Marga, and Roga Marga and human understanding, human body understanding, and Roga Marga and Srotas, and the Doshanam, Shakat Koshtabhigamanam and Koshta Shakabhigamanam, they can be able to apply these different concepts. And they are having the no much struggle with critical thinking skills, such as Roga Marga and Amavata understanding. Whereas the understanding Nija and Agantuja Karana in terms of Roga Marga application. Whereas the concrete examples, they can be easily stated by these star learners. Whereas the abstract thinking or summary of the learning, what we can say the elevator pitch, can be done by star learners very easily. And they are knowing what kind of the study technique will be helpful for them for the better understanding, and what kind of the strategy one has to use, when to use, what kind of the notes making they have to utilize, whether is it the linear method or non-linear method, how to do the mind mapping, etc. They can be in a better position to understand this particular part. So that is what we can say the star learners of Roga Nidana. When you think about the in terms of the novice, pro, and star learners, novice learners, they can be say that only about the Bahya Roga Marga or the Abhyantara Roga Marga or Madhyama Roga Marga. Whereas the pro learners, they are in a better position to apply the Roga Marga in terms of what do you say that the human body itself. Whereas the star learners, they are in a better position to understand why this Abhyantar Roga Marga is considered to be alimentary canal, why the Madhyama Roga Marga, that is the knee joint, is considered to be a Madhyama Roga Marga. They are in a better position to give the explanation properly. When you think about the Bloom's taxonomy and the learning categories, the persons who are in the remembering and understanding level, they are usually considered to be novice learners. Whereas the students or learners who can do the application, analysis, and evaluation of the information, they are usually at the pro learners level. And the learners who are doing better evaluation and they can create their own creations, then they are usually at the star learners. So that means when you think about the difficulty in learning level, increased difficulty is being observed in case of the novice learners, pro learners, and star learners. To sum up, depending upon the nature of the learning, quantity of the time put into the studying, etc., we can able to make the learners of Roga Nidana into three categories: novice learners, pro learners, and star learners. Wherein the novice learners are usually having the very primitive knowledge about the subject of Roga Nidana. Whereas the amateur learners, they are not having any of the knowledge related to the subject itself. Novice learners, they may be having a little bit knowledge, but the application, etc., that will not be present in case of novice learners. Whereas pro learners, they are having the understanding of the subject in terms of the difficult terminologies. Whereas star learners, they are in a better position to create their own new concepts and they can give the hypothesis based on those created new concepts. So, dear learners, identify your level of learning, where you are standing, whether you are a novice learner or pro learner or star learner, and try to upgrade yourself. How I can upgrade from novice to pro learner? How can, if I am a pro learner, how I can move towards the star learner, do those different learning skills so that you can reach to the star learner of the subject of Roga Nidana. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in this channel in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.